All right, I want to first start off with a little diagnosis, and if I can play a little bit of a sound here, try to get the diagnosis of this particular patient. See if you can hear this. Okay, so that child is just coughing quite a bit. So what did y'all think it was then? Okay. And you said stridor. And again, I think, he pretty much did get what it was whooping cough. And why do I start off with whooping cough? That's an interesting kind of disease. I mean, this poor baby coughs and coughs and coughs until there's no more air left in its lungs. And then it has to gasp for breath. And that whooping you could hear in this child that was coughing, I mean, rupturing the blood vessels around its eyes and vomiting and having pretty much stopping breathing, ending up possibly with pneumonia. And I mentioned whooping cough because, as you probably know, whooping cough has just really started to pick up in the United States, a disease that had pretty much been declining for decades. It's now been increasing, and here's a graph showing the number of whooping cough cases increasing. But I specifically have an issue with it because, as this is a headline from our local newspaper, whooping cough cases rise dramatically in Polk. This is happening right in our own community. It's in the Tampa Bay area. This is something the media has picked up on and is trying to help educate parents and everyone about it. And as I've seen in the county, the number of cases really has gone up, and this is the number of confirmed whooping cough cases in my county, and we're dealing with quite a few of them here. But every time we get this reported to the public health department, we find out that we do our investigation and we ask, where did this disease come from? And we find out every single time we're pretty much investigating a little baby that's in the intensive care unit. And of course, as you know, we'll find out who's it really connected to. It was probably a parent or a babysitter or an uncle or somebody who's our age, because when we catch whooping cough, we don't get that sick. And we tend to pass it along to others. And because our vaccines have worn off. And the little baby's too young to get its vaccine, so it gets it. Now, when we do the investigation, we often find those people, and it's too late to test them. They're already in, what's it called, the phase? After the proximal phase of whooping cough. You have your catarrhal phase and then your paroxysm. What's the phase after that? Okay, I'll just call it the long coughing phase if you're not going to give me a medical term. So you get into this chronic cough that lasts for quite some time, and you really have a hard time isolating it. So when we do those investigations, we find out that the other cases, you start adding up about 4 dozen cases that we've had in the last couple years just in our community. So when we look at that, we try to get that message out there. We can protect you from this disease. For those of you whose vaccine has worn off as you've gotten older, there's a booster shot, and we need to do that after 11. And you want to especially say, if you're going to be taking care of a baby, if you're going to be a new mother, and you all are real familiar with this message, if you're going to have a new baby in the house, or you're going to work in a neonatal intensive care unit, get that booster shot if you haven't. Of course, it comes with the tetanus shot and the others. So, now, when you look at something like this, I see something that is clear, concise, and it's memorable. And in fact, this is the one day that I can wear this badge because I'm a health officer. So I put this away here. Usually gets me out of tickets or whatever. But you ever get that kind of question? If any of you around children, you ever had a child say, "Well, what do you do?" Well, you're probably flashing back with Margarita Cancio there at 2 a.m. seeing patients. How do I explain to a child, what do I do? And we can say so much. But isn't it true you could pretty much clearly and memorably say to a child, I do 3 things. First thing I do is I prevent bad things from happening. Is that true? You do that? I prevent bad things from happening. Also, I try to promote a good message that can be shared by others. And lastly, I protect. Now, in our case, we protect the community. You're protecting other patients. You're protecting family members. You're protecting the patient themselves from something bad that might happen in the future. So when you think about it, you have the same thing in common as public health. And you could say this to a law enforcement officer, an architect, a banker. They're doing the same three things. But that's the part that we have to remember. It's communicating clearly, so it's memorable. Now, Richard, does this automatically move forward? I just noticed sometimes it does that.
You may just have to tap the pointer rather than holding it down.
Okay. So those three things, preventing bad things from happening, promoting a good message, and protecting the public are what we are doing. And that don't sell short any one of those. Promoting. When I saw that picture of that child there, when you see that somebody asks you a question, or you're trying to teach them, let's say I'm teaching them about prostate cancer or taking your high blood pressure medicines. If that child then goes home and tells their parents, or those children share the message, I've just amplified my voice. So my one message has been shared with a number of different people, and that's another key to public health, is that promotion part of it. We know we can't do it by ourselves. We need help of you, the physicians, and we really thank you for what you're doing out there, both in private practice, as you're learning in fellowship, and supporting both with research. We get that message out and we promote all the good things that we're doing. Now, more specifically, what we see is that we have a little struggle at times. 10 years ago when I started, we'd walk up to folks and just say, ask the person, excuse me, what does the health department do? And commonly that's what people did. They just looked at us and went, what does the health department do? You said, yes, it's your health department. It's paid for by taxpayer dollars. What do we do for you? And so they would think and not really say anything, smile friendly and say, I know. You give shots and you take care of syphilis. Now, that's not really fair, is it? Is it real fair? Where's Doug? Doug Holt's not here today, but that's not fair. We have staff that are working very hard, and they're doing more than just that. In fact, I put together this next slide to really show you what the health department does, and I'll pick the county that I'm from, the Polk County Health Department. Basically, here's what the Polk County Health Department does. Okay, well, that's the whole point. You run out of room. From an international travelers clinic to looking at radioactive materials and testing for safety, to going to rabies prevention, indigent health care, injury prevention. We take care of pregnant women, provide nutritional support for children. The list goes on, and I can share quite a bit about that. Not necessarily what I'm here today for, but keep in mind public health is doing a number of things in the environment, in dental, in healthcare, in disaster relief. So there's a number of things that we're doing. So we often say people take things for granted. They'll say, hey, you might be visiting somebody in my county. Now, I have a very rural county, away from the cities in some parts. And so when you're visiting somebody's house and they give you a glass of water, where do the ice cubes come from? It's where's their source of water? We don't think that, it's a well, right? And where's that well? Where's that well usually located? Not too far away, right? It's just in the backyard. But then when you flush the toilet in that house, where does that water go? It goes in the same backyard, how far away from the well. So, we've had communities where these things were a little too close together. They wouldn't put in a hygienic way, and you could get E. coli and other dysentery problems. And having a health department making sure that these are installed properly and that the septic tanks, which work very well when installed properly, but you drive through our county and you can see sometimes there are these mounds, where the toilet water goes into the tank and then it flows out through these pipes into the yard. Hopefully they haven't parked their car on top of it, but that's where it goes. And if the water table is high, they have to actually build it up high. That's what a health department staff puts those in the right way. Okay, well, there's other questions I don't know the answer to, so I don't know when the Bucks are going to win the next Super Bowl. But, because we're involved in many public health issues, we're going to get the common questions, and I'm sure you've already had these. Every friend, relative, nurse you walk by, they're going to ask you the disease of the day. And so what about this MRSA? What about this swine flu? What about this thing that's going on? We'll get questions from this thing, if it's salmonella in the peanuts, whatever's on the news. We'll even get questions about CSVD. Now, what's CSVD? Elliot, what's CSVD? Oh. Well, it's cruise ship vacation diarrhea. And so you'll get those questions every single time when people are investing a tremendous amount of money for their trip. And you'll get those kinds of questions. And that's where, really learning from Dr. Cancio on the service we provide. We will stop anytime, any part of the day, no matter how busy we are, and answer questions because it's really important to that person, their family. It might be a partner physician, might be a nurse. They're going to have this question. Now, especially, I'm going on an airplane trip, with a baby. What's my chance of getting the flu? And we're going to have to answer those questions. And we give them sound advice that's been researched, unlike what we heard, out of Washington with maybe somebody saying the wrong thing. We can give accurate information that gives people a little bit of reassurance. I made it up. So it's not a real disease. It makes people worry. And certainly, as I tell my lay audiences, being infectious diseases, I like talking about nausea, vomiting, and diarrhea, usually while you're eating. And certainly on a cruise ship, when you have diarrhea, I said, listen, when you're wiping yourself after a bowel movement, it's soaking through the paper. And you've got billions of germs on your fingers if you don't wash your hands. And you're going to pull that slot machine handle or press that elevator button or whatever. Now, of course, if you're the guy that's making the salads for the ship, that's the problem. That's why the cruise ship industry has taken this so seriously. And they've actually taken a number of measures which actually put them a little bit ahead of the curve with this new influenza virus because of all the precautions they're doing with hand hygiene. So now the cruise ship industry has learned a lot, and we can learn a lot from what they've done. Well, the Polk County Health Department, I could say there's 67 county health departments in the state, one for every county. And it's a pretty large operation. We have about 500 staff that come from different walks of life. So I supervise about 500 where there's nutritionists and dentists and, of course, the administrative backbone. And it's a big, big county. It's about 60 miles across. So I have 19 separate buildings throughout 5 different cities. And it keeps us pretty busy with that. But our, our budget, it varies, $29 to $30 million. We get it from different sources. It might be from services we provided, fees. If somebody doesn't take care of their water system and was supposed to check it for certain contaminants, we can fine them for that. But, that's not the point of where, this badge is. We tend not to want to even use this. In fact, I never wear this because the point is we want to get compliance. We want to get safety. We want to get improvements. So it's not a got you type of thing, whether it's somebody making someone sick at a restaurant or someone not taking care of a water system. It's like, let's teach you on what you need to do. Because I have 800 water systems in my county. Okay, and that's really a mobile home park that serves 200 people. He sank a well. He's responsible for 200 plus lives, and we got to make sure they take care of those things. So we get funds from our county government, federal, grants, seeing patients. We have an HIV clinic. So it's a number of things we do. But we find that there is also a lot of partners out there. And one of my first slides, I showed a bunch of logos, but we have to work as a public health system together. That's where you are an important part of that. You might be going off into private practice, and you will zero in on what you need to do to take care of your patients and your business and your family. But keep in mind, you're a part of an entire system. And so it may involve what's happening in government, what's happening at large events, what's happening here we're seeing with schools. And if you thought that you could just be in by yourself, well, try to run your practice when 3 of your staff have children at a school that had to be closed because of the concern of infectious disease. And so you see how we're all interrelated and need to support each other. So there's a lot of people working in public health. That's about 500 people that work for us from varied backgrounds and different things like that. Now, just to show you a little bit more about environmental, this is, I mentioned septic tanks. All the sharps and needles that doctors make and hospitals make, we make sure that they're disposed of safely and properly. And certainly if a child picks one up and pokes himself with it from a playground, we get that phone call just as you probably do on your HIV needle stick hotline. We inspect the mobile home parks to make sure they're not too crowded. and actually migrant labor camps. We will go out into the migrant labor camps and not only check to make sure that they're safe, but we actually go in the living facilities and make sure they have a kitchen, bathroom, that it's actually clean and no one's being taken advantage of. And we'll find clandestine migrant labor camps that we need to bring in compliance. And sometimes it's not a matter of got you, close it down. It's here's what you need to do to have a safe, healthy place, because these are the people working hard picking your food. And we have to make sure that that's the key issue there. Well, let me ask a question. Does the health department inspect restaurants? No, we do not inspect restaurants, and there's about 800 restaurants in my county. The people who inspect restaurants are the same folks who inspect the elevators. I'm just sort of kidding, but it's the Department of Professional Business, the Department of Business and Professional Regulation, DBPR. That agency is a state agency, and about, 15 years ago, it was taken away from the health department and given to that agency. They have a section called Restaurant and Hotels. And these guys are basically the restaurant inspectors. They're trained to inspect restaurants, and you could probably follow that. Now, when somebody gets sick, if it's 2 or more people, then the health department gets involved in that inspection. So we're able to go out with the regular inspection, make the review of what caused the disease, and then make a report. And actually, it's not about the report. It's actually stopping whatever happened so it doesn't happen again. So the health department gets involved in that. Now, we do inspect school cafeterias, jail food, hospital food. So some of you all eat here, that's the health department doing those inspections. We inspect theaters and bars, the Moose Lodge. So it's interesting, that's the two. Now, it turns out those 2 agencies I mentioned, they don't inspect delis and grocery stores. There's a third agency called the Department of Agriculture, and they inspect the delis. And since they inspect the gas stations, and you get this, let's say there's a certain, I don't want to say the name, but a sandwich shop often in gas stations that make a certain kind of sandwich that goes under the water. They'll inspect that restaurant, which sort of makes sense. If they're going to do the gasoline part of it and the convenience store part of it, they also do that restaurant there. Radioactive issues is I have a lot of phosphate in my county, and phosphate is often mixed with uranium. And if I remember my science, and I'll ask Richard, what does uranium turn into?
It decays to plutonium, right?
God, I hope not. No, go the other direction. I think it's actually the other direction. It goes to radium, and then to radon. And radon is a gas, so it percolates up. And in the old days, they used to dig up the phosphate not too well and then just sort of cover it up, leaving some of the phosphate mixed with the uranium. And I think that would be a problem. Then what's the second most common cause of lung cancer in the United States? Radon. Yeah, radon. Cigarette smoking, radon. So it comes up through the ground, and if you put your house on top of that ground with little cracks in the foundation, and then you run a dryer? And what does a dryer do? A dryer sort of sucks in air, heats it up, and then blows it out. You're basically creating a vacuum. So if you've got cracks in your foundation, you're pulling that up. So we measure houses for radon. And the point I'm getting across is I'm just an infectious disease physician. I didn't know anything 10 years ago. And to think that I'd have to give lectures on teen pregnancy prevention and radon, I don't know half of what I'm saying, so I'm making most of this up. But it's a very exciting job to be in public health. As you can see, I bet the reason many of you are in infectious disease, and in fact, I'll back up, I bet why many of you are in internal medicine is because, other fields just didn't cut it. You really wanted to do more. You wanted to do that little bit of cardiology, that little bit of rheumatology, and then the best of all, you've joined infectious diseases. And in the Division of Infectious Disease and International Medicine, you find that you're not just treating fever caused by germs, you're looking at all the causes of fever. It could be cancer, it could be lupus, it could be a drug reaction, and that's why I think, our field, infectious disease, is the best. Well, you take it one step further. What is our role in public health? Well, you look at Dr. Holt and all the great things he's doing, and you see what we're doing, and that's why it doesn't stop. The phone rings, and you'll get the most outrageous things getting called about. Indoor air quality, drinking water we mentioned. I have a dental clinic in the back of that building. That's why I put it up there. Oh, yeah, that reminds me. The media is out there. Now, the media, No, they're nice. If you feed them, they're very, very nice. What they need are facts. Get that off there. What the media needs is information to share. And I really am disappointed in anyone who thinks that the media is not working with, getting the truth out there. This is a key part of getting our job done. Really, a lot of what we do is trying to get information out there. Now, I give a lecture, not tonight, but about how to communicate with the media. The reason I would want to give that lecture to you, because the same principles apply to what you do with the patients every day. It's communicating clearly, memorable, it's concise. You hit somebody with 20 pieces of information, they forget it. Other than they might think you wasted their time, or they'll get half of it wrong. You want to communicate clearly. So working with the media is going to be key, and it's part of what we're doing. I'm going to ask you to do a little bit of this here in just a bit. Of course, I'll give you an example. I like showing this slide. I usually stand right in front of the projector in that midst of Allie, I'm going to pick on you. What's the term for all that stuff right there? No, snot. That's right there. Gosh, that's... Okay, yes, droplets. Well, and that is, that's a good point, because what is the one message I think I'm going to throw up if I hear again on television? What's the one message you've been hearing lately? Give me a few that you've just been hearing over and over again. Yeah, a little bit of that. What else? A little bit, something similar to that. What else have you been hearing over and over again? Wash your hands. Wash your hands. Sneeze in that, but it's and why do you do that? So you don't sneeze into your hands. And so I point out to my audience with a visual that guy's infected. The whole lining of his nasopharynx has got billions of germs, and they're shooting out right there. But you know what? They're stuck to the mucus, and that has gravity. And unless this was, a 6-year-old child sneezing right in your face, okay? If I'm standing where I'm standing, this is all going to fall to the ground, and I'm okay. So we know that's not really how this germ is going to be spread. It's not going to float along the air and go across the room and like lightning hit you, which is unfortunately sometimes the public doesn't know. They don't know, and that's going to scare them. And so we don't want that to happen. We want to get the truth. The truth is visual. That has weight. That snot is heavy. It's going to fall to the ground eventually. But now, what does he really do? And everybody knows what you really do is you put your hand in front of all that stuff and all that mucus, or you pull out that tissue like, yes, like you're doing, yeah. Now, look how flimsy that tissue is there. Dr. Kasanis, you can demonstrate just how much that greasy food soaks through that napkin there. And that's going to soak right through, and you're going to get all those billions of germs on your hands, and of course you're going to touch something else, and that somebody else, innocent person, Richard sitting right next to you, yep. Yes, you're going to pass the salt shaker or whatever, and you're going to have those billion germs on here. So to get the point across, what's the next thing we've been telling people what not to do with their hands? Oh, that wasn't very nice, Richard. I didn't like the way that sounded, so no. What? No, something about you. What should you not do with your hands? Yeah, don't touch your eyes. Now, I'm not really sure, because I understand. I'm not really sure if that really gets across the point. So what I say to the audience is I try to put it in context that they probably already know this. But I say, when we're talking to our kids, it's really good to say to the child, hey, go look in a mirror and look at your lower eyelid really closely. In fact, pull down your lower eyelid really gently and look in the mirror at your lower eyelid. Now, when you look at your lower eyelid, look at the edge of your lower eyelid and follow the edge towards your nose. If you look carefully as you pull down gently, you'll see a hole. And this is where I ask my audience, what's that hole? Now, I know you know what it is, but but they'll often say tear duct. And as a little bit of a surprise, I'll say, no, that's not it. It's actually the lacrimal punctum, which whatever, but I'll say the tear duct or the tears gland is actually on the opposite side. It's on the upper outside part of the eye, and you can see on this diagram just above the ear there is that's where the tears are coming from. And I explain to my audience the tears are coming 24 hours a day, and unless you're crying over a really good movie, you don't want them running down your cheek 24 hours a day. As you blink, the tears get washed from the upper outside of your eye down to the bottom corner there by your nose into that hole, that lacrimal punctum, and that's a tunnel. that goes straight back down to your sinuses and your throat. You shake somebody's hand who sneezed into it, you've got billions of germs now on your hand. You rub your eyes, you now have billions of germs up by your eyes. You blink a couple times, you've washed your nose, and boom, you're infected. Or you can pick your nose, that's a lot faster. But that visual, to me, even if I prefaced it as, you probably already know this, it's good, baby, to remind you to teach your kids, you can see the look on the faces of most folks to say, oh, I get it. That's why you don't want me. I mean, how does it go from my eye? I mean, when I catch a cold, it's not my eye that is red and my eye is not sneezing and, you know, my eye doesn't have this soreness on it. It's my throat. How could rubbing my eyes get to my throat? This visual and that short story, which I made a little longer, that gets the point across. That's communication, and it makes for people to come back and say, you know what, I'm going to ask you a tougher question about something that's important to me, and thank God, hopefully, it's a question I really need to answer. Like, should I pull my children out of school? Should we go to that field trip? You know, and if I say something, they'll say, well, you know, this health department steered me the right way, or that infectious disease doctor was right on the money on that other issue. And I'm going to follow them. And that's when you see, and as I rounded this weekend at Tampa General and saw the patients of Dr. Mayer and Dr. Cancio, they were just like, you've heard it, to say, wow, they are the best, you know, because they sit down and talk to you, and they really are getting you that information across. So really the remainder of the time that I want to mention is a little bit about crisis. This is an old slide. It's almost a little bit of a cliche. You all know how many have heard this one before? I mean, it was yeah. So this crisis is I have here the Chinese word. At least I'm told this is the Chinese word for crisis. Thank you. And as you notice, the word for crisis is made up of two characters. And you're gonna now you can help me, right? So the first character there actually means danger. Okay, and you know that makes a lot of sense. You've got a crisis. You've got a hurricane bearing down on you. You've got a new flu virus that's out there. You got MRSA in the community. You got a crisis. You got danger. But what's the second character shows a lot of wisdom. The second character actually means opportunity. Why would the word crisis be made up of two characters, danger and opportunity? And it makes perfect sense. With every crisis, even though there's danger, there's an opportunity to learn more, to take an opportunity to see how to do things better, how to avoid the crisis to begin with. And that's what we're going to move forward. When we've had hurricanes, we've had terrorist attacks, anthrax, hepatitis outbreak in my county, we learned a lot from that, and just, you know, whatever else is out there. When a big event happens, you are foolish to just worry about the danger. You know, if you're a family at home and you're saying, you know, we got this issue, let's make a plan. You know, we're seeing this thing happen. If there was a bad hurricane, and you saw that hurricane, you saw what happened in Katrina, you know what? We better have a family plan. If we ever get separated and something happens during the day, what are we going to do? Where are we going to meet? What kind of supplies are we going to have? That's the opportunity you took because of a crisis. That's the message we want to teach in public health when it comes to disaster preparedness, which is the main topic tonight. So my county got hit by 3 hurricanes with 100-mile-per-hour winds, and my office is right in the center of those 3. So we were pretty hit and had to deal with that. In fact, there's another map of that. There's my office right in the center of the tracks of the 3 storms. You know, lots of damage. We saw everything there. Our county, Polk County, did an excellent job responding. We handled it. We handled 3 hurricanes in less than 60 days. And we did it for a system that I want to share with you today that goes on to be what I'll call the Incident Command Structure and the Emergency Operations Center. Now, this is the Emergency Operations Center, and it's also called the Recovery Operations Center. And what I see here, and it's not too evident, is there are different tables and they're in different sections. And what we see here is how are you going to organize things? Well, they've numbered it. When you have a disaster, like a hurricane or the flu or whatever, there's certain areas that you can compartmentalize. So I'll give you an example. Every table is numbered. There's a table for mass care. It might be number 8. Or number 6. There'll be a table for the utilities. There'll be a table for law enforcement, a table for animal control. So during a hurricane, we had a bunch of wild animals running around because their fences were knocked down. They were chewing at the utility workers. We had nursing homes without power. They needed to be evacuated. We had lots of damage and roads were closed. So if I'm sitting at the medical table, which is table number 8, I got the call that a nursing home needed to be evacuated. Well, I could turn to table number, and I'll say it's table number 4, it's the transportation table. They had access to school buses. I could then turn over to the law enforcement and say, are the roads open? We're going to take this road right here. All right? And we could work through it because everybody was in the same room. So that's happening in every single county. And why is it happening? Hurricane Andrew devastated Miami, and they weren't ready for it. After Hurricane Andrew, every county has an emergency operations center, and it's organized the same way. So if I move to another county, I'll be talking the same language, and that's going to be very helpful. So a lot of folks were very busy. This was you would call it the emergency support function 8. This was the medical side. We were doing things like, oh my God, the schools closed for a week. Why is that a problem? Why if the school's closed for a week, why is that a problem? Parents couldn't go to work. Yeah, and that was pretty obvious. But you know what? We saw a bigger problem. Parents who worked for the hospital couldn't go to work. Parents who worked for doctors' offices couldn't go to work. Big hurricane, lots of people with chainsaws cutting off their fingers, doing who knows what, and you've got a hospital that's short-staffed because the schools are closed. So one of those phone calls we're making are to local churches and saying, you know what, I got a lot of staff who have nothing to do because our clinics are closed. You have a very big church, and one was a city hall, and we used a recreation center. Can we borrow it, and we'll make it a daycare for healthcare personnel only? Hospital workers can drop their kids off. We'll watch them for free. We'll have trained nurses there. We'll get volunteer kids from the community because they're out of school, and we're going to do it. Only county in the state that did anything like that, and indebted us enormously to the hospitals were indebted to us enormously because we saved probably $80,000 because they would have had to pay for replacement staff, pay for sick leave or the leave for the employees. They would have had to pay for their own daycare centers if they tried to run their own. So it's that kind of creativity. And you know what? We didn't stop there. We thought, well, gee, we've got all these kids for a week. Why don't we teach them about, I don't know, hand washing, conflict resolution, not to smoke, food safety? So we brought Publix in, the fire department, and they keep coming in. They did something every day. Publix came in and they made cakes, cake decorating, while they also taught them how to be safe in the kitchen, anti-smoking types of things. We even had one kid break his arm, which was the owner's worst nightmare. That kid wanted to come back the next day. Okay, so it worked really well. And the best part about it, if we tried to plan this ahead of time, it would have never worked because the attorneys would have said, well, the liabilities and this and that. But when you call the mayor up and you say, can I use your church? And he's going to say, yeah, well, how many kids? 300 kids? But then he has to look out the window and he sees all the trees knocked down. He says, sure, we'll get it done. So that was a very interesting time to go through that. And here we are, we're checking out all the kitchens, all the free food that got put up. We need to make sure the food was healthy. And so we're checking out every day these kitchens to make sure they're safe. We're passing out water, information about mosquitoes and things there. But I want to move a little bit to the flu. I don't know if you all have a piece of paper or anything or something you can write something down. I want to try to group you into little groups here about something here. During a disaster, when you're the one having to deal with it, and it is your problem, and this can happen anywhere, how do you organize yourself so you don't forget anything? Now, you could have a table organization like this, or like this, okay? Which is, I think, the federal government's approach to domestic security before September 11th. But we want to have something that makes sense and approaches it. So how many of you have had training in incident command? Okay, so this is how it works. We're going to take an incident. It could be any incident of importance. It could be something sudden that you are unexpecting, like a potential flu pandemic, or it could be something planned, like a parade or whatever. But it could be anything that you'd be involved with. Now, I'm going to talk to you today about it because this is a medical one. It's going to be about the flu and what's going on behind the scenes when it comes to influenza. We're going to break things down into these different categories. This is an example of a thing we had when we ran out of flu vaccine a few years ago. And so that's what this slide came from. But the beauty of this is it doesn't change. The labels don't change. And everyone uses the same terms. medical people use it, hospitals, law enforcement, and EMS, fire rescue, emergency management. We all use the same thing. So there'll be an incident commander. Okay, now the goal of this is not to have that incident commander have 25 people come to them, but to have it broken down. So at the top, and I'm sorry if you can't read that, the top is liaison. The liaison has got to hook up with other agencies that you're going to be hooking up with. So this is in the context of a health department, and I want you all to think of yourselves as an incident commander in a health department. Okay, so you're going to have somebody working for you, you've designated, and they're your liaison. They're going to have to work with people outside your agency. The next one is safety. You're all going to have to be part of safety, but there's going to be a specific person that's going to be concerned about safety. And I think during the hurricanes, what do you think some of the safety issues were for a health department? Think about it. You've got 500 employees, you've had a hurricane, and you've got a job to do. What kind of safety things would that safety person be worried about? Yeah. Okay, how do you get your employees to work? What else? Yeah, what kind of things would make them unsafe at work after a hurricane? It's been it's been 3 or 4 days. There's nothing falling and there's nothing electrified. Yeah, clean water. Yep. And now I say the health department is taking hundreds of phone calls. And we're out there doing lots of inspections, and we're all over the place. So what other things might you worry about with your employees? Mosquito bites, and I think stress. And I think a big part of the safety area is the behavioral aspect. And I think that's true for any of us. If we have a pandemic, we better make sure we're looking out for each of us. Because if we decompensate, if we freak out, that's going to be really bad. So we pay particular attention to our own safety because we can't help other people if we're depressed, over anxious, post-traumatic stress. If we have a pandemic and there's, if this happens next year and there's, have you heard the stories that if there was a lot of people out sick and that you were worried about your own safety, you might have a lot of anxiety and you might become dysfunctional. You might feel that you've got to do everything and you're not sleeping. So you can see where the safety officer has got to think of all these different things, let alone the safety of the family and what's going on at home and they get to work safely. The next one is public information. And in my department, we use that public information to get messages out both internally and externally. Security, I'm not going to go into that, but that's basically depending on the situation, if you had to guard something like a vaccine supply or what have you. Medical officer is the actual physically taking care of medical issues that come up, and here you see Dr. Sambunwit was at that time our medical officer. Logistics is the getting the stuff you need. So if you think about a pandemic, what kind of stuff do you need? And that's what we'll try to work with logistics. They're going to steal it, borrow it, buy it, however it means. If the incident commander or someone else says, I need this, and the thing is, the example would be the firefighters. You need helicopters maybe to fight a forest fire. Well, if somebody just said, get me a helicopter, there's 20 different kinds of helicopters. There's helicopters that carry people, helicopters that carry water. There's ones that evacuate people. There's ones that can, go a certain speed. So the logistics person has to know the details. So think of that in a pandemic. What are the logistic items that you might need? Finance and administration is important because eventually somebody might pay you back for all the stuff you did. And in hurricanes, that makes sense because you get declared a national disaster zone and a declaration of emergency. FEMA will reimburse you for legitimate costs of overtime and equipment. So if you don't keep track of it, you won't get reimbursed. Operations is probably the most important one. That's the doing. What are you doing? And it depends. Like here, we were maybe doing things like buying and selling vaccines, and we were doing things like surveillance and other issues. So what exactly were you doing? And lastly, it's the planning, thinking ahead and being the crystal ball in the future. So let me try something here. Is if the four of you could get together right here, or actually in the back, the 5 of you there. I want you to come up with things that you would need logistically in a pandemic flu. What kind of stuff do you think you're going to have to be gathering? And I'm talking about like right now. Like right now we have issues here with these flu cases. I want you to just take about 2 minutes, just discuss what kind of stuff, and then just let us all know what kind of stuff would you need. And then this group right here, I want you to look at liaison. If you're running a health department, who are you going to have to reach out to so there's no misunderstandings, and who are you going to have to talk to, and roll off some of the things you're going to have to reach out to. And for y'all here, public information. What's going to be, who are you going to be communicating to, and what are you going to be communicating to? And this section right here, what did I leave off? The operations. What kind of operations are you going to be doing? What are the functions during right now? Right now we have the swine flu that's spreading around. Just think about what are some of the things y'all would be doing. And then in about 2 minutes we'll try to see what do y'all think. So just discuss it amongst yourself and say, well, what kind of stuff you would want to do.
Make sure we have vaccine, medications, operations. We have adequate.
So what we're letting them discuss is what exactly would you need in order to respond to the community's needs as a health department. And in this sense, breaking it up into these categories really helps folks understand how not to forget anything. Now there are things that you have with regards to an operation, like what exactly are you going to do during this swine flu concern that we have. There's a new flu virus out there, and we haven't learned as much about it as we like. We see that there's flu in Mexico, and there's not a lot of information. We know in the United States there's new cases showing up, but it doesn't seem to be that serious. It's been mild with only one death. So there's certain things we need to do right now in order to understand it. Well, that's the operations section. And you don't want to forget to not do something in order to help the community. Now you're also going to need to work with partners in the community. And who are those partners? That's the liaison section. And then there is the stuff you need to do it. That's your logistics section. And I think I'll focus lastly on how are you going to get that information out on what you're doing. And that's public information. And you don't want to forget, you want to make sure your own employees know exactly what to do, and they have to be well informed. So that's also information too. And all this has got to be orchestrated under the incident commander. So in just a second, we're going to ask the group what do they think, and we'll help them along here. All right, well, why don't we just sort of throw out some ideas here on what would you do if you were running the incident command and you would choose people whose specialties were in these particular areas, people that you trusted, and you could have some turnover to where people can get some sleep and move on. So who did I pick for operations? All right, so what, as a part of a health department, we'll get to the meat of it first, is what are you going to do? You've got this new flu in Mexico. It's now shown up in California. Now it's in other places. It might be in Florida, and it is. So what are your operations? What kind of things did you all come up with?
Well, we defined operations as basically facilitating getting things done. So to investigate,
Getting things done.
Yeah, investigate new cases, to support other branches, you need to have adequate transportation. That includes vehicles.
But so now you're getting into logistics, but that's perfect. You will have maybe an investigative branch, and so the investigative branch might have to travel, and they might not want to use their personal cars. They might want to be able to be well marked so people can come up to them and ask them questions. So you've mentioned the investigative part of it. So that's one of your operations. You'll have a branch called your investigative branch. And so they'll be headed out there, and they're going to have needs. And you might have to turn to the logistics table and say, get me some cars. Good. What else?
Personnel support, in order to get things done.
Well, tell me the things you would get done. That's, again, people are actually logistics items. I'd have to go to my logistics section to say, I ran out of employees. They're sick with the flu. I need more employees. So you'd go to logistics, and they might say, oh, I have a medical reserve corps. And they'll come in and volunteer. So again, that's the things you need. I want to know what you're going to do. So we know investigating cases of possible swine flu.
Right, so you'd be looking for new cases, you'd be
That's something different now. So you're investigating cases, but you just said looking for new cases. We call that what? Surveillance. That's another branch. You're going to have a surveillance branch, and they're going to need stuff. And your surveillance branch, they might be calling up nursing homes and saying how many people are sick. They might be calling schools up and say how many kids are sick. They could be calling sentinel physicians and hospital ERs, and so you've ramped up your sentinel. You might be getting data from a computer database that says how many over-the-counter cold medicines are being sold at CVS and Walgreens and other pharmacies, which they do. And if you see a spike in the sales of cold and flu medicines, that might be your earliest sign that your community is experiencing a flu outbreak. Yep. And we saw a spike in thermometers right after this came out. And you know what? Poison control might be one of your surveillance tools. So poison control, why would poison control be one of the best surveillance of an outbreak of the cold and flu? Yeah, you think about it. You're at home and you get the flu before you go to the doctor or the emergency room, and before you go to CVS or Walgreens, you're going to go to your medicine cabinet, bring down the cough medicine, drink it, and you're going to forget to put it back up. Little Johnny comes along, drinks it, you freak out, and you call poison control. They track why you're calling into a database. Poisoning due to cough and cold medicine. That's your earliest warning sign. So again, you've mentioned these very good surveillance systems that you have. Okay, so surveillance, and then what follows is investigation. So those are two operations. Anything else? Well, let's see. Well, that's obviously my fault, so you've really... Well, so you're talking about treatment where logistically you'd have to go to the logistics. Yeah, you're doing all their work. So treatment, and that's a big issue. So you're going to have people have the flu, and they're going to go to their physician or ER, and they're going to be prescribed Tamiflu or Relenza, and they're going to go to their pharmacy and get it. What if they cannot afford it? Okay, there might be stockpiles available that you're overseeing, and so you'll have to have a treatment operation where somehow accessible 24 hours a day, it can be dispensed, be tracked, because these are legal pharmaceuticals. There's been a declaration of emergency in Florida that allows some streamlining of this. So all this has taken place, and so you're ready for that treatment arm. Let's say you go out and do that investigation, you swab somebody's nose, and what are you going to have to do with that swab?
You're going to have to take it to a diagnostic facility.
Yeah, and you know, depending on some of the things that you might be doing on other public health emergencies, if it's something like anthrax, you're not going to give that to the DHL drivers. You know, yeah, you have to have special training, and so you might have an operation that deals just with shipping. What was the April Fool's joke that we had just the other day? Yeah, you remember? Somebody at a hospital, a lot of envelopes. Yeah, somebody put like 89 envelopes of white powder on people's cars at the hospital in Sebring. Yeah, it didn't go over real well. They actually like had to fly. They actually looked at getting a helicopter and flying the sample to the lab so they could find out fast. So transportation issues would be an operation if it got big enough. I think you pretty much covered it by covering it the round that you did. The other things that we're doing, we have a clinical sites. Health departments have prenatal care and pediatrics, and we know people are going to be coming in with flu, and some of our patients are from Mexico. So we have that as an operation. We also had the actual training issue. You've got 500 employees. Do they know how to collect nasal swabs, you know, and wrap things up to be taken by DHL, to be transported? Have they been fit tested for masks? You know, so we call this, and I sort of like the name of this, it's called just-in-time training. Which usually means we haven't thought about it, and we'll do it now. So just-in-time training, that's where you go out. Because if you train people 9 months ago, they're going to forget. So you might as well just do it just in time. So looking at the training on how to, maybe crowd control might be something, and I'm getting ahead of myself. Since they covered your logistics, since they took all your stuff, think about planning. I want you to just think a little bit, just individually. There is a section I did not assign. It's called the planning section, where you've got to predict the future. Think of things that we need to be thinking of now. We don't need to be doing as an operation. We don't need to be getting logistic stuff for it. But we need to be thinking about it, because if you don't think about it, you're way behind the eight ball. So think of planning issues. Now, the other one I wanted to go to was liaison. Who was the liaison group? Okay. Well, you're doing this, and remember how I started off the beginning? If you can't do things by yourself, it's not a good idea just to be doing it by yourself. If you do, all disaster will strike, and you will lose trust. So who do you want to liaison with? And part of this is, if anybody in your organization gets a phone call, it should go to the liaison officer if it's from somebody from the outside. But you don't have to wait for them. You can go to them. So who would y'all want to liaison with? So we got swine flu, and if you saw the press conference on Sunday, you'd have the answer to this. There was a press conference that Dr. Haight did. So who would you liaison with? You got flu breaking out.
Probably somebody with the authority that people trust.
Yeah, you want to get to other authorities. Because remember, is this flu outbreak occurring in your department? No, it's happening where you live. So who would you want to be calling up and talking with and saying, hey, how are y'all doing? You're an entity, you're an agency out there. Who would it be? Yeah. School board. School board, massive partner. If the school board comes out and closes all the schools, and you're the health department, and you're like, well, I wouldn't have recommended that, and then the paper quotes you as saying, I wouldn't close the schools and cause all the... Man, I tell you, we got a problem, okay? And I tell you, this is what I don't like here, is I'm going to say something. But, all right, so you really want to be on the same page. You said the mayor. It's their city. I mean, this is their people. These people elected that person. That person better be standing there. Who did you see at 9/11? Rudy Giuliani. Who do you see in New York talking about flu or whether airplanes and subways are safe to ride? Mayor Bloomberg. Okay? He's the one. Okay? That's the person that's really the person there. Liaison with who else? Any other ideas from anyone else? Who else? Police and fire. Yeah, they're going to be worried. They're saying, I'm not going to go protect your clinic from that crowd trying to get your Tamiflu if you don't protect me and my family. All right, that's a fact. And liaisons could be things like the jails. You could have a big outbreak in a jail, and if it's not hooked up to and you got other free clinics, you've got whole other sections. Let's see. Well, the hospitals. As a health department, we're on the phone every day to the hospitals. How many cases? What are your employees doing? Are they freaking out? Or let's calm them down. Let's get them the facts. All right, then that moves us to public information. Who had public information? All right, so what do y'all think? What is the public information group going to do?
We kind of broke it down. Public information goes to the two different groups: the external for the people outside of the health department and internal.
Absolutely perfect. You do internal and external communication. That's exactly what we named it, because we have to think of both of those. So what are pick one of them and let's go through what would you do for that group? Let's see.
I mean, we first started the venues of giving external information. Of course, there is radio, there's television, and then there's the internet, whether it's Facebook, Twitter, or off your website of your whatever Department of Health that you're at, and talking about basic things, trying to give true facts of modes of transmission of the disease. Are there cases in your county? The signs and symptoms, how you can decrease the transmission.
Absolutely. And then the modes of it, you mentioned some ways of getting it. One that I was very interested in, I just did it. The reason I was almost late is I sat at the computer, I drafted a statement that was exactly 60 seconds long. I went into a computer, logged onto a website, and I cut and pasted my statement in there. I clicked a couple buttons. It gave me a phone number and a password. I dialed the phone number and the password, and I read my statement. Clicked a couple more buttons, and in a half hour, at 6:30 tonight, 120,000 people will get a phone call with my recorded message telling them about how it is safe to go on field trips, or how you as a parent can do something. You as a parent can talk to your kids about how germs can be passed from dirty hands by touching the eyes, and that there will be chaperones ensuring that the kids are healthy that are attending the field trips, and you shouldn't put your child on the field trip if they're sick. So 120,000, it was translated not by the computer into Spanish, but it was translated by a person and it was read in Spanish. And it was also sent as an email to probably 20,000 people. Okay? Yeah, it was, it's a state secret now. But it is, again, and I'm describing a system by the Polk County School Board called Connect Ed, and they utilize it for things like this. It might be cold weather, it might be something advising the parents, and in here, it's letting the community know, 100,000 people who got their kids in school, that, and my message was basically, currently we have no confirmed cases of this new flu in Polk County. But it's a situation that changes frequently. We will keep you updated. If you have any questions, here's the flu hotline. And so that was pretty much what our message was. So that is a communication. Internally, it's the same process. Like you were saying, you're going to get the facts out to folks. And lastly, we had the planning section, which is the reading the future. What am I as the incident commander? I'm so busy dealing with phone calls. The liaison folks are saying you better talk to this county commissioner. You know, the hospital this, and you're needing all these stuff to deal with it, and I've got to get it from logistics, and we were hearing all those things. You're doing a great job, but my planning section, you know, there's an old saying that the firemen use. It's called, "It's never the fire." And the example they give is that big fire that some of you might remember was just north of the interstate I-4. It shut down the interstate during Super Bowl weekend. Okay? You would think all you needed to do was put out the fire, right? You needed helicopters and water. You needed people. You needed a communications plan. But the old saying was, it's never the fire. Because you know what happened next? The governor wanted to take a look. So you needed to stop this and do security and have a landing zone and cars put in. And you know, that's very important. The governor needed to be there. He needed to see what was happening. But this wasn't the fire. This was something unexpected. But if you were planners, you thought ahead and you said, you know, there's going to be interest. There's going to have to be, our boss is going to come down and want to be involved and be able to get assessment of the situation. So that's the planner. So what do you think? What's the planners in this whole swine? What do I got to worry about right now? Now, say Polk County. We have no confirmed cases at this time. And
in the next 2 days, you have 5 confirmed cases. How are you going to deal with it?
Absolutely. What are we going to do? What if somebody dies of it? You know, what are we going to do about that? What if we run out of this? What if? So this is pretty important. Now, some of it you can go, oh, no, that's not going to happen, and move on to the next issue. But you said something. What if we get 5 cases? All right, well, I got to go to the liaisons. I got to go to the school board and say, you know, we're doing good. We're working together real well. I just did that message with, with 100,000 people. I just got that message. We're working together real well. Just had a conference call with 25 cities this morning, and we've kept them informed. But I need to talk to you at the school board. So I have my liaison group call the school board and say, you know, what if we get 5 cases and they're all in one school? Do we close the entire school district down or just that one school? Let's think about it. All right? How do we deal with families? How do we get medicines for them? What if they're undocumented? What if somebody is dumb enough to scapegoat people? That's another issue, is that they're blaming, oh, this is a problem and it's coming from this one group. Well, we got to put a stop to that. What if there's a rumor and whatever? So those planning issues. And again, you're going to bring issues up that we all need. So I think you all are going to do well. I think you're going to make it through this disaster. You know, I appreciate all of your input. Any particular questions? We covered just the surface of this. Some of the training on incident command, if you have free time. On the FEMA website, you can get to some free training to give you an introduction to this kind of stuff if you're ever interested. But spend a few days with us out in Polk County. You're all welcome to shadow us, work, see the Emergency Operations Center, view our water plant. Beata, you took a tour of our water plant, and see our international travelers clinics if you're interested. Any questions at all? Great. Well, thank you all very much. You all have a good night. Take care. I enjoyed it.